Montgomery. Oh, it says I'm connecting. Hopefully I'm broadcasting. Wanted to welcome you to Nonprofit Montgomery's call with DHHS and county leaders, and say thank you to everyone who signed on today. We had about 300 people register for the call, so I will ask everybody to be very patient with our technology. We're actually getting good at this, but you never know. Just want to thank you, the Nonprofit Montgomery team, Meredith and Mindy, for helping to facilitate the call today. Thanks to our Nonprofit Montgomery's board members who've signed on, as well as all of you nonprofit leaders, county council, county staff, and county leaders for signing on to the call today. I wanted to give you a quick overview of the agenda before we get started, and also a little bit about the functionality of Zoom. If you have questions, you can hover at the bar below the screen and put in your questions in writing. And then you can also follow along the side the chat function, which will tell you, if there's websites or other resources, we'll make those available in the chat. And then the entire webinar is being recorded, so we will put it up on our website later on. So we're going to start with some remarks from Councilmember Albornoz. Then after that, we'll hear from DHHS, some health news, and then topical info related to contracting and all the other DHHS questions. And we have submitted the questions you sent in advance to everybody on the panel. Following that, BB Otero and Caroline Sturgis will let us know what's going on from the county executive's perspective. And then we're going to do two sector updates. Heather Bruskin from the Montgomery County Food Council and Ann Mazur from EveryMind to talk about the really important topics of food coordination and mental health, both really important at this time. And then finally, we'll have a Q&A at the end where we will read out your questions and field them to the panelists. So again, thank you very much for joining. And I'd like to just kick it off by introducing Councilmember Gabe Albornoz, a man who needs no introduction, the chair of the Council's Health and Human Services Committee and staunch nonprofit supporter and advocate. And we welcome you. Thank you for being on our call today.
Thanks, Lesley. I appreciate you and Nonprofit Montgomery and your board and everything that you guys have been doing. We've had the chance to speak a number of times over the last 2 weeks, and so I know you're very much on the front lines helping to coordinate a lot of the activity and answer a lot of the questions that are out in the community right now. But I want to begin by really acknowledging and thanking the entire nonprofit sector. As I said in my comments yesterday during our council session, the term first responder has really been expanded. I think everybody on this call and every single one of your organizations is playing a critical role in helping to ensure that we shore up our safety net through this unparalleling, challenging time. And I don't think that's a word, unparalleling, but unparalleled and challenging time. And I also know there's a lot of anxiousness and anxiety among the leadership of the various nonprofit organizations. I'm sure you're already worried about your constituents and your clients and their concerns. You're worried about your staff and making payroll. You're worried about events that have been canceled and galas that are on the horizon and you're not sure whether or not they're going to carry forward. You're concerned about what happens to donors and sponsors, and we know all of that. I have felt that in the many conversations I've had with nonprofit leaders over the last few weeks, and I just want to let you know that we feel it too, and that doesn't even include the challenges with your own families, having to do phone calls from home and juggle all the things that you would normally have to juggle times 10. So I want to start from that place, is just acknowledging the challenges and the struggles that you're feeling, and let you know that the county is going to do everything within its power to support you and your organizations, both as organizations, but all of you individually. And having worked in the nonprofit sector prior to being on the council, I know how challenging this work can be on so many different levels. So we're fortunate that we have the strongest nonprofit organizations in the country, in my opinion, and some national best practices right here in the community. And all of you have stepped up in so many different ways. I want to give a few general updates, talk a little bit about what we're seeing in the community, what we're hearing from constituents, which probably tracks with a lot of what you guys are seeing as well. But I'll start with yesterday. The council did in partnership with the county executive branch, we introduced two bills, one for $20 million, which we're making available to organizations with 100 or fewer employees. That includes nonprofit organizations, and the grants will be up to $75,000. Now, we have cast a wide net in terms of what those expenses can cover, rent, also payroll, paying different contracts that you have to cover right now. We're leaving it fairly open-ended, acknowledging that there needs to be some flexibility in how those funds are spent. Obviously, there's going to be a lot more demand than there will be supply of funds available. And so right now, literally as we speak, we are working on, among my colleagues and I, figuring out in partnership with the executive branch exactly what the criteria will be for organizations to be able to apply. We are using some lessons learned both through our grant application process, which is already in place. We're also, this is very fluid, following closely what the federal government is making available and what the state has recently made available, so that we're not duplicating resources available at those two levels, but that are doing something that's more unique to our community and takes care of those holes that may be out there and not clearly covered by the funding opportunities at the federal and state level. So all of those things are happening right now with regards to the 20 million. The 5 million allocation to HHS, many conversations are going on there as well. There are obviously a number of line item and budgetary issues that have hit the Department of Health and Human Services as they're trying to support organizations. And I see my good friend Vickie Buckland is on the call, and I know others from HHS are on the call too. But we are looking at an allocation of some percentage of that 5 million, yet to be determined, and the process also yet to be determined, but to make at least some funds available directly to families who are in crisis and need right now, and who may not be covered by some of the federal and state funds that are being made available as well. So in addition to organizational support and support for the department as a whole, we're also looking to see how we can directly support families who are obviously in crisis right now. So all of that is very fluid. We will have a lot more information tomorrow at this time than we do right now at this time. And understandably, there are a lot of questions with regards to who's eligible, who's not eligible. Another question that's been posed is arts-based organizations who are doing incredible work as well, and whether or not they will be eligible, and of course they will. And I've had conversations with Councilmember Craig Rice, our lead within the Education and Culture Committee, about that 20 million. And as we look at it, to see if there are subcategories to make sure that certain sectors are included in this discussion. And we want to make sure we try to minimize so that as few organizations as possible slip through the cracks. So that is something that we are working on as well. So that's on the funding side. Now, in terms of what we're hearing out in the community, we are hearing a lot. So I do give a lot of credit to HHS, who has stepped forward and as quickly as possible tried to unravel some of the bureaucracy that exists within county government so that we can free up contracts and we can make things more fluid for organizations so they can have more flexibility to address the needs of the clients that they're trying to serve. We are tracking a lot of different things right now. One of the areas that I'm personally especially very interested in and concerned about is mental health, particularly just as one of many examples, our immigrant community. Even before all of this happened with COVID-19, because of nefarious and terrible policies from the Trump administration, there was already an anxiousness and anxiety in our communities. And this has just put people over the edge. And I've heard from Maria Gomez, I've heard from Diego Uriburu, I've heard from a number of people in this space, among many, who are just being overwhelmed by residents and clients who are just going through extraordinarily difficult times, hard to even process. So we have been working with HHS, and we're fortunate to have a director of Health and Human Services who has a background in behavioral health. And I know Dr. Crowell and his team are very much focused on this issue. And we're trying to also support organizations such as EveryMind and many others who are providing frontline mental health support for families who are currently in crisis. So that's one area. A second area that we're very much focused on right now is our homeless population. And I want to thank Amanda Harris and again, our Department of Health and Human Services. I want to thank Susie. I want to thank Shane. I want to thank all of the organizations who are directly serving our homeless population right now. Their staff have reported concerns about there being sufficient equipment. And of course, we are trying to alleviate that by partnering with our Department of General Services to get more equipment available to staff in the form of masks and gloves. That is a problem globally right now, as everyone knows. But the department and the county, through our procurement office and the Department of General Services, is working aggressively in trying to access many more of these products. We've also talked as recently as this morning. There are a number of county residents who are stepping forward organically that may have supplies and materials in their basements or in their tool sheds that they're not utilizing and would like to donate. And so we're working on a process for people to be able to make those contributions. And the other thing I'll mention for now is we are also starting to focus on the next phase of this crisis. And so we are working with our hospitals on what's being called surge capacity. We learned alarmingly in our update yesterday from Dr. Travis Gales, our public health officer, and Earl Stoddard, our Director of Emergency Management and Homeland Security. There are 167 ventilators for the entire county. And so the 6 hospitals are working with FEMA and the Maryland State Hospital Association to identify more ventilators and more equipment that our hospitals are going to need in order to be able to support what inevitably we anticipate being the next wave of patients coming in. And so that's an area that we're focusing on. Then the other thing I'll say is that Councilmember Navarro and I have been working aggressively in trying to ensure that the information that is currently being shared with the community is done in a culturally sensitive way, that it's not just multilingual, but that we are doing a better job than we have currently on reaching our hard-to-reach populations. And we've been working with the county's public information office, and a recent strategy has been implemented to enhance that outreach. And the council, based on a conversation this morning, is interested in expanding that even further. And we'll be reaching out to the executive branch to talk about how to strengthen that operation as well. So those are just some of many of the issues that we are focusing on right now. I should also mention the Health and Human Services Committee and all of my colleagues are doing a call 3 days a week now, Mondays, Wednesdays, and Fridays, with leadership from HHS, where we relay issues that we are seeing that have been shared with us, and we are in constant communication to try and shore up and make sure we're expanding our reach and supporting both residents and organizations as best we can. So that is the 30,000-foot overview, and I'd be happy to do my best to answer any questions that people may have.
Great. Thank you so much for coming on the call and sharing those perspectives. I know, I think there'll be a lot of relief in the sector to hear that the council is putting forth some grant dollars to help people stay in business throughout this crisis. So that's really wonderful news. And I know for those of you who are planning to ask the question, when will the money be available and how can we apply for it? I'll just say from our last phone call this morning, we don't know, and we'll let you know because it hasn't been decided.
I will say this, and the council kind of planted a flag yesterday. The District of Columbia, after the their appropriation was passed, was able to turn it around in 7 days. And so we're going to put that out there as a benchmark. And my colleagues in the Office of Finance within our county's department are going to be to help facilitate that process. But we know we need to turn this around as quickly as humanly possible.
That's great. Thank you so much. All right then, well, let's move on, and we will take questions at the end just to remind you. Let's hear from DHHS. We have Vickie Buckland, Chief Operating Officer, and Mark Hodge, Special Assistant to Vickie Buckland. Mark is our health point of contact. Please take it away.
Great. I did see one question. There was questions that were for Gabe that only he can answer, but there was one question that I can answer. There was a question about whether the shelters are going to be staying open through or closing as they do normally at the end of March. And the answer is not only are they staying open, we're actually opening 2 more shelters to limit the number of people that are in each building. So we're opening a shelter at Cofield Rec Center and one at Long Branch Rec Center. And again, that's just so we can limit the number of people that are in each building. So we don't want large numbers of people congregating anywhere, especially in our homeless shelters. So not only will they be staying open, but we're actually increasing the number right now to help with social distancing. So just as an update, and I don't have any special information. This is all information that I encourage you to look at yourself. When you can, on the Maryland.gov website, as well as the Montgomery County Maryland.gov, MD.gov website. We have tons of information that's updated as frequently as possible. There is guidance that is provided to providers on the state website, as well as our own website. And so I really encourage everyone to check those websites out as frequently as possible, because there's constant updates happening. I do want to share some numbers with you if you haven't heard or haven't seen. As of 10 o'clock this morning, there were 423 confirmed cases of COVID-19 in the state of Maryland. 127 of those are in Montgomery County, and still just 1 death related to COVID-19 in Montgomery County, 4 deaths total across the state. Interestingly, because you may have heard that this tends to be seen more often in the older senior population and less so in younger populations. It's true for the under 18 in Maryland. 5 cases are under the age of 18, but 335 of that 423 are happening in the 18 to 64 range, with the majority of those being in their 40s. So there's not any severe complications associated with that. Some people are being hospitalized, but as I said, only 4 deaths total across the state. And then the 83 of the cases across the state are in 65 plus. So we're actually doing really, really well as far as keeping the death totals down. So our hospitals are doing a great job now. It doesn't mean that it can't get worse, especially hearing that there's only 167 ventilators, and that's where most of the issues seem to happen for the severe reactions to this particular disease. But so far, we seem to be in the same range as countries like Germany and Norway, where they have a very low death rate related to COVID-19 because of some of the things that they're implementing. And I would venture to guess that because we're doing a lot of the same things that other countries across the world are doing in Maryland, that the social distancing and shutting down places is starting to be effective. It's things that other countries have done to keep the death rate lower. And so there are certainly a lot more cases out there that we don't know about. And so because of the absence of testing, or the absence of even having the test to test people with currently, but that just makes our rates actually our death rates even lower. So so that's about all the information I have. There is new testing guidance about who should be tested right now on the Maryland State website. you can certainly look at that. I'll be happy to send that to Lesley for her to distribute if she wants to see that, or if you want to see that. Gabe talked a little bit about our supplies. We are working really hard to get more supplies in every day. What that looks like for community providers is unknown at the moment. We have, and I think I mentioned this last week when I was on the call, we have local distillers who are creating large batches of hand sanitizer right now, working with local distillers, not only in Montgomery County, but across the state of Maryland. We are now getting it in barrels, and that's the description that we're getting. And so it's in a very short time, we should have a fairly good supply of hand sanitizer. Other companies across the United States are working on increasing production of wipes and other sanitizing cleaners. They're really focused on sending those to New York and California. I think I mentioned that last week, where the need is greater. And so companies are having to prioritize when there's not enough supplies, and they're having to prioritize to the places with the greatest need. And so we continue to look for those procurement, and our Department of General Services continue to look for supplies of all of those cleaners, disinfectants, gloves, masks, everything. And so I'll try to continue to keep you updated on our supplies moving forward. We are focusing on getting supplies to our Montgomery Cares clinics, as well as the homeless shelters when we can, as well as the front-facing programs here in DHHS. So I think that's all I have.
Great. Thank you so much, Mark. And Vickie, I'll turn it over to you next. And I feel like with Governor Hogan's announcement, not quite shelter in place, but almost, and the closure of non-essential businesses, that I think raises a lot of questions for nonprofits about what we can and should do at this time. So if you could address that in your remarks, I think we'd all appreciate that.
Thank you so much. Obviously, as Councilmember Albornoz alluded to, there's a lot going on, and we're working very hard to stay in close contact with stakeholders across the continuum, whether that's the county council, the nonprofit sector, our fellow departments. Obviously, this is a community-wide response, and all of those folks need to stay in alignment with each other. With that in mind, one of the things that I know has been a point of question for a lot of people is simply, how do we make sure that we know what's happening with county services and with services across the community? I really will encourage people to go to the county website. It really is a trove of good information. One of the things that's in there is a link, and it's actually right near the top on the right-hand side when you go to the coronavirus page, is a link to what is the current, what's closed, what's open, what's operating under modified service provisions. And it's a quite extensive list. It's not just HHS, it covers all kinds of services across the county. Now, it is county service centric, and I know there are a number of organizations that have asked questions about how do we share information with each other well, regarding what's open, what's closed, what's being done in some alternate ways. Obviously, that's information that we in HHS are very interested in, partly because we contribute to some of those financially through contracting, and others that we partner with organizations on. So we've been in some active conversations with the Collaboration Council, with Nonprofit Montgomery, and some others on what are some different ways that we can collect that information. And so that's something that I hope we will be able to put in place pretty soon. In the meantime, we're asking people to really make use of the communication channels that are open to them now. Things like, reaching out either to either to Nonprofit Montgomery, to us, if you have contracts with the county, whether that's HHS or other departments, reaching out to those points of contact to make sure that that information is being shared. I know there have been a few, I've gotten some feedback that there have been a few misperceptions about what is open and what is closed as far as HHS services are concerned. In particular, I had some feedback around, there was a general announcement that HHS had closed some of our lobbies to the public, and that got interpreted as HHS was actually closing services. And that's actually not the case. So I do want to make clear that with very few exceptions, all of our programs are operating, but a number of them are operating in different ways. That's partly why it's really important to go to the website, because it actually details a lot of that information. So for example, food stamps and TCA, we are still offering those services, and I'm sure you can guess as well as I can that there are a whole host of people who are going to need those kinds of services moving forward who might not have walked in our door before. We are encouraging people to fill that information out online because that actually is a capability that's existed for a long time. Not everyone makes use of it. And we're really encouraging people to look at that avenue for getting that information in. We do work with people over the phone. We do have some clients who might not be comfortable or might not want to use the online resource, but they're comfortable emailing documents into the social worker that works with them. We're open to any and all of that. For people who still want to fill out a paper application, we are still taking those, but we have some drop boxes at our facilities where people can drop that off. Part of what we are trying to do is to be good about following our own advice regarding social distancing. So we have limited how many people and whether people can come into a few of our spaces, but that does not mean that our offices are closed or that we're not providing services. And I do want to make clear that that's the case. There are a lot more details, including links to applying online that are on the website. I'm going to be sharing kind of a list of good resources with Lesley and asking her to share that with the wider nonprofit community. And we'll also be putting some of that on the county website. A lot of it's already on the county website, but there's a specific part of that that's geared toward nonprofits and community providers, and we'll make sure that there are some good links to all of that that's available. The other thing that we're trying to share widely is to simply be transparent about what we're telling our own staff. I did share with Lesley a little bit earlier. We had sent some guidance earlier this week to our own staff regarding protocols for home visits, protocols for frontline staff. And so we're simply making that available to the wider provider community as a model. Again, you're independent organizations, you get to make a lot of your own choices, but sometimes it's helpful to simply see what someone else is doing. And so we're trying to make that available just in the interest of being helpful to different organizations. I know there are lots of questions amongst providers about what the changes at the state level regarding orders for what's open and what's closed, what that's going to mean for providers. Obviously, there are parts of that we're working through ourselves in our own operations. So I don't have definitive answers for all of that. This is partly why we're so committed to remaining engaged with you and all the stakeholders who are involved, because all of this is moving very quickly, and frankly, we just don't have time for us to come to definitive answers that answer every single case that might come up and to push that out all at once. So we are really counting on organizations to be good, open partners with us, to engage contract monitors and to engage, you know, people like me, people like Dr. Kroll, and the chiefs of our service areas in those conversations, so that we can work out those cases as they arise. To the extent that we can provide general guidance, we will do that. Some of that is a work in progress. And so I know that that answer is less satisfying than a lot of folks would like. It's certainly less satisfying for me to say than I would like to be able to say. However, it is where we are. And so please, please, please do keep those lines of communication open. We got a number of questions ahead of time. I really appreciate that people do submit questions ahead of time. There are a few of them that I do have some answers for, and I want to make sure that we share those up front. There were a number of questions about that hopefully folks who listened at 11 a.m. To the conference call with the county executive would have gotten some answers to that. There were some questions, for example, about changes to unemployment compensation and stuff related to COVID-19. The state has made changes to unemployment rules, and workers who are out of work due to COVID-19 are eligible for unemployment benefits. That information is actually on the state website. It's one of those links that is going to be part of what Lesley will include for everyone. The other piece of information that we've gotten from the state has been some clarification. The word we're getting from the feds is that the support that's being provided around testing, you know, the governor has been very clear that they don't want anyone to avoid testing for financial reasons. And so there are a variety of mechanisms that they've talked about that will help make sure that people don't have financial barriers to being tested if that's appropriate in their case. The word we've gotten has been that that kind of financial support will not be part of the calculation regarding public charge. And so people should take advantage of that. If they're in a position where testing is appropriate to them, please do take advantage of that. Please do go get that testing. We don't want that particular fear to get in the way of someone's health. So I did want to make sure that got mentioned. We've had a lot of questions around supplies. Mark talked about some of that. The other thing that I will encourage people to do, and to be perfectly honest, this is some of what we're doing in our own operations. We have a few places in our own operations that are very front-facing, where we're prioritizing what limited supplies we have, but we have a lot of other places in our operations where people would love to have masks and all kinds of stuff. I do need people to be clear about what is clinically indicated and where you actually have sometimes more alternatives than you think you do. I know that, you know, as we talk with our own programs, this is something we have to emphasize, and that is that, you know, spray bleach and paper towels works really well. You don't need Clorox wipes in order to get that benefit. Masks are for people who are sick or who are in very close physical proximity for an extended period of time. But that's not necessarily for your staff. If you're accepting paperwork or you're, you know, across a desk from someone and nobody has any symptoms, we're not giving our own staff masks in that situation. That's not the clinical indication at this point. So I know that there's a lot of anxiety around that question. Again, I will still encourage people to share those needs with us. And especially as there becomes more supply available, we'll try to be helpful in that space. HHS itself is not the lead. I know I said that last week. That's still true, unfortunately, or fortunately. I guess I'm not sure I want that job right now. But that said, there are a lot of organizations where we tend to be the primary point of contact for them. So please do still share that with us. Our commitment is to be true to the requests that we get and to pass those along. And I think for the moment, that's enough to be going on with. I know there are some other really great folks coming after me who have some very good things to say. There are a couple of questions in here that are specific to food. HHS and the Food Council have been working closely together, and Heather's coming up. I'm going to defer to her on all of those because the Food Council is really taking a leadership position there. And thank you very much for your time. I appreciate it.
Thank you, Vickie. I'm sure we'll be coming back to you later. Okay, at this point, I'd like to turn over to Caroline Sturgis and BB Otero, who are leading up the nonprofit response from the county executive side. Welcome to both of you. And if you could, any remarks you'd like to make, please feel free to share.
I'll take a quick start and turn it over to Carol and Lesley. Thank you, and thank you for the work everybody in your organization has been doing to help coordinate all of this, and certainly to Councilmember Albornoz for the collaboration that's been happening between his office and the council and the executive. Hopefully many of you had a chance to hear the executive this morning, and a lot of the questions may have been answered. I just want to say that the value of these kinds of gatherings is really important for us as we're trying to design things that we have not had to design in the past. So in these relief efforts, your recommendations, your questions, any of what you share with us is really helpful as we shape to make sure that we've got the best thinking possible as to how to both shape the way these funds are put together, the way the applications are done. We've talked about what we've heard from folks constantly. We're constantly adapting. So please keep those coming through both the questions here and the questions that you're sending directly to Lesley and to all of us. So I want to say that that's really helping shape this. And it's been really important to have the call last week and the call this morning and then this one to help us continue to shape it. And we have taken the challenge from the district to be ready in 7 days to get an RFP out. So challenge taken to make sure that that is out the door. The one thing that is a constant moving part on all this is what the federal government is doing and what the state is doing. So this morning we heard that the schools will remain closed until the 24th of April. That changes some of the considerations that we were looking at. The same with the federal government's decision. Once we have a good idea as to when those dollars are going to come out, one of the things we've heard from Mark is we want to be able to fill gaps so that we are, and I think Gabe and others have said it, is we want to make sure that we're not duplicating, but that we're really trying to expand all the resources we have as far as possible. I do want to say that one of the concerns we all have, and however all of you can be helpful, is reaching those communities and those individuals and those families who don't necessarily have contact with organizations on a regular basis. Not everybody connects with a nonprofit throughout their lives. Not everybody is connected to HHS, but yet they are in need, and they are very much folks who we need to be able to reach out to. So please keep that in mind, and any thoughts you have about how we get to folks who may not be in any of our radars right now, but really need the help and support. So I'm going to turn it over to Carolyn so that we have more time for questions also.
Sure. Thank you. Once again, thank you, Lesley, Nonprofit Montgomery, for having me here today to share what efforts we're doing. Looking at the questions that have come in, there's a question regarding, how will the $5 million special appropriation be dispersed in a quick fashion? We are at the point of developing the program as well as the process. We were doing that in collaboration with Councilmember Gabe Albornoz, and his team will be participating in a task force. We've already organized a task force with members from several of the nonprofit community. Some of them are here on the panelists today. We are having our first meeting later on this week on Friday, where we will really work through how the program will look and as well as how it will work. Our goal is to ensure that we develop a process where direct financial assistance can reach the hands of the residents in a very quick fashion. So that is the goal that we're looking at. We're also working with departments from the county, HHS, as well as our finance department to ensure that that can happen. I also wanted to address a comment that I heard early on regarding communications to nonprofits when there are service changes or closures within the county. We did develop a consolidated database email distribution list for all of the nonprofits that we have a contract with in the county. So that email distribution is ready and available. So as soon as we are made aware that there will be a change in service or operations within any county department, our commitment is to push that information out as quickly as possible. So I did want this community to know that we heard your request and we have created that distribution list. I believe a lot has already been covered, so I do want to ensure that we do have time to answer your questions. So with that said, I think I will defer and allow someone else to speak until a question.
Great, thank you. And we do have about 20 questions in the queue, so we'll get to those at the end. Next up, we've asked Heather Bruskin from the Montgomery County Food Council to give us some insight on the coordination in the food sector. Welcome, Heather.
Great, thank you so much, Lesley, and all of our county's leaders who are getting us through this situation together. And I've been inspired by the really important work that's being done by so many in our community. So thank you all. As Lesley shared, the Food Council is serving as the connective tissue in the food-based response that's happening in the county in partnership with DHHS and many other community partners. And so we are striving to keep a bird's eye view of everything that's happening related to making sure that all of our county residents have access to safe, sufficient, nutritious food as we navigate this crisis. So I'll give a brief update on what's happening related to food access in a variety of different settings, as well as just a little bit on the food economy, because I know a lot of people have had questions about that as well. So as many of you are aware already, the Food Council is hosting a call once a week on Mondays from 1 to 2:30, and that's open for everybody to participate, and we'll be providing updates on what's happening related to food, as well as convening all of our providers to make sure we have updated information on changes to their services as well as the needs in our sector. So I encourage you, and I'll put all the links in the chat box in a bit, but we encourage all of you to participate for regular updates on this information. So MCPS is currently offering 3 grab-and-go meals to everybody 18 and under at a variety of sites around the county. So there are 23 elementary schools, 10 middle schools, 9 high schools. They're using school buses to distribute to other community locations in 3 buses throughout the county, 5 mobile locations as well. And so we're regularly working with them to determine what are ways that we can expand services as well. Currently, they do have limitations coming from the USDA on where these meal sites can be. So we're also staying in touch with other food assistance providers to see where those communities that currently aren't able to have sites have other resources for the children and the residents in those areas. The Senior Nutrition Program has suspended its congregate meal sites, but they are currently allowing seniors registered for those programs to get up to 7 frozen meals once a week. And they will go and pick those up at rec centers, but if they are housebound and aren't able to get out, Department of Rec employees are going out to deliver those to homes. And they're also working with their ethnic meal site partners to see if those restaurant partners can also package and deliver meals to participants as well. There had been a number of senior congregate housing communities that had shuttles that were taking those seniors to grocery stores regularly. And while those shuttles are no longer operating, they instead are working with the residents at those housing locations to get those 7 frozen meals brought to residents as needed as well at those sites. And the Capital Area Food Bank is running its Groceries to Go program. It's currently serving 500 seniors in our communities, and they're delivering double the amount of food so that they can reduce exposure and have fewer deliveries to those residents. The Capital Area Food Bank currently has 22 distribution sites with partners throughout the county. And while they're not taking any new partners at this time, they are looking for partners to potentially help with delivery. In particular, they need 18 and 26-foot trucks with drivers available on short notice to take all of the products that typically Montgomery County partners would go to DC, pick up the products and bring them back. But now they're doing delivery only, and so could use some help with infrastructure on that. Manna Food Center is doing tremendous work in our communities. They've waived income eligibility for all of their clients. They're looking into home delivery with older participants and those with health conditions, and are adding pop-up pantries. They also encourage people to use Community Food Rescue and are using that app as much as possible to redirect food through food recovery to get to residents, and use these food runners to do home deliveries as well. And their weekend bag program, in addition to with 3 other partners, 3 other nonprofit providers, are serving, I think Manna Food Center had 3,000 weekend bags last week, and these numbers will only grow. And so they also could use additional cold storage in particular, or locations with extra refrigerator space. In addition to the providers that I've mentioned, we're working with over 70 food assistance providers in the county to meet the needs of residents throughout the community. And they're participating in that call every week and adapting their services to transition from choice pantries to more packaged strategies so that there's less interaction, and obviously employing lots of new strategies to protect the health both of their volunteers, their staff, and their program participants. One thing I did want to note is Maryland Hunger Solutions has a call center. It's a 1-800 toll-free number where residents who would like to get support in submitting their SNAP application, they can set up a time to do that. And we have Food Council staff and other partners who are working on that call center as well to help Montgomery County residents get connected to the services that they need. And we are administering a survey every week, collecting information from providers. Currently, we've had about 50 providers respond, indicating that they need things which are not surprises. They need funds, they need food and sanitation and hygiene products, as well as PPE, the protection for the safety of their volunteers. And in general, they need financial support, as I shared before as well. And so we'll stop there, but just to say we'll be doing these regular updates every week on our call. And so we encourage you to stay up to date with by interacting with us. Just some quick notes about other things related to food. However, we have a MoCo Made website, which lists lots of different ways that we can support the small businesses that are run by county residents. And that's a way to have products often delivered right to your home. A lot of our grocery stores are opening up early for seniors, and there's a list of that on the county website as well as our page. And a lot of our smaller retailers are actually shifting to exclusively or somewhat only online orders. So that is a good thing, in that it reduces the time that shoppers are in the stores and interacting. It could potentially be a challenge for a lot of residents, particularly those who are using SNAP dollars to fund their grocery shopping, because SNAP is currently not allowed online. open. And so that's something that we've been looking at from a policy perspective. Farmers markets are open. They're obviously an important food access point, and especially for those residents who are using double dollars, although these markets are using new strategies to protect their vendors as well as their shoppers. CSA enrollment is generally up in the region, so that's community supported agriculture, and the Food Council has a virtual CSA fair if you'd like to sign up to get a weekly box of produce from Montgomery County farms. Our local food producers are going to be critically important to us in the months to come, and whatever we can do to support them, that's important to do. Visit Montgomery has a MoCo Eats page, which shows you how to buy from local restaurants, again, in low and no touch ways. And in general, the Food Council has a pretty comprehensive website with everything related to food. But if there's something that we're missing, and there's a lot of good work happening out there that still needs to be communicated, please reach out to us so we can make sure to capture that and share it with everybody.
That's fantastic, Heather. Thank you so much for sharing all that really great information. And as I was listening to you, I was thinking to myself, thank goodness we have the Food Council, you know, because all of that is so important at this time. So that's awesome. And we will, again, come back to you with questions. And last but not least, we know mental health is huge. And Mazur of EveryMind, if you could chime in and fill us in on what's going on in mental health. And if you could unmute yourself. Wait, maybe I can do it.
I'm unmuted, I think.
Yes, you're good. Thanks.
All right. Hi, everyone. Thank you all. This has been amazing. I've learned so much already. I know that briefly wanted to go over mental health and some information about the sector. First, as we heard throughout this, obviously, stress and anxiety is running higher than ever. So from the mental health perspective, we are ramping up, trying to serve clients that were already in mental health services across the sector, including EveryMind and all of the other providers across the sector. We have moved over the past week and a half to working with our clients by telephone, converting to telehealth and providing mental health therapy by telehealth. I know that many providers have already made that shift. Many others are in transition. Those in transition are communicating more than ever, whether it's by telephone or by video chat or telehealth. I think that I know this is a very broad group, many people on the calls, many people that don't normally have to be as involved in mental health and that work with their clients. That's something that we're well aware of, that we're trying to prepare for. Gabe mentioned the community in contact with HHS and the county executive's office, et cetera, of how we can increase those services and prepare for what we believe obviously will be an increased need over the coming weeks and months, and I hope not longer than that. A couple things, because I know we have a lot of questions we want to address, that I just wanted to highlight as far as mental health, and a couple primary places for individuals on the call and organizations to go to. EveryMind supports the Montgomery County hotline. That's 24/7, phone, text, and chat. Text and chat are from noon to midnight. Phones are 24/7. With that, we don't, some of the conversations that actually Gabe mentioned at the start is for those individuals in our community that are non-English speaking. I want to address that. We don't have on the hotline capacity for non-English speaking, but what we do have is a close connection with the Crisis Center, the Montgomery County Crisis Center. The Crisis Center does have that capacity. So if you can refer them to our hotline and we can do a warm handoff to the Crisis Center if it's an individual that does not speak English, or you can directly send them to the Crisis Center by phone or in person. And then also wanted to highlight, if someone is in true crisis, the National Suicide Lifeline, which we do answer. They actually have a line for Spanish speaking individuals. I've shared that, and we will share that also on our website. So related to mental health, so I can wrap up quickly because I know we have lots of questions. On the EveryMind website, which is every-mind.org, we, right on the front page, we do have links to mental health resources. We've been trying to gather together there specifically related to mental health. It has the information for the hotline, crisis center, other supports that organizations can provide to their clients, at this time. So Lesley, I'll pass it back over to you because I know we have a lot of questions and we're already at, at our end time.
Okay, well, I told you we weren't going to end on time. Thank you so much, Anna. It's good to hear, and you'll keep us posted on how we help meet those mental health needs. So turning to the questions, one thing that I've heard from a number of nonprofits is with the county grant. I know it's not, written in stone yet, but there are a lot of nonprofits. There are nonprofits that have more than 100 employees. And it would be nice if they could also be eligible for the grant funding. Those are some of our big, really critical service providers. And I believe there's precedent in that. I think the minimum wage law had some consideration, special consideration for nonprofits regardless of size. And so I just wanted to put that out there. Maybe Councilmember Albornoz could speak to whether or not we might make an exception for nonprofits over 100 employees.
And Councilmember Albornoz, I'd also like to ask, piggybacking on that, if you could also address whether it's 100 in Montgomery County or if it's overall, since we do have a number of cross-county providers on the line. Thank you.
Absolutely. So it's an excellent question. And for full disclosure, I used to work for a nonprofit that had more than 100 employees and offices regionally. So I'm very familiar with how those operations work and how important they are, especially now in our time of need. We are going to look at various amendments, and that's one that I'm going to certainly consider. I want to collaborate with my colleagues in the Department of Health and Human Services to get a better sense of how many of those organizations there are here in the county. I know of 3, just off the top of my head. So because we want to make sure that, especially those organizations that all of you guys are on the front lines, but we want to make sure that those organizations are not unduly impacted by not being able to apply for these funds when we know they need them. So it's an amendment we're going to consider, and I'll discuss it with my colleagues both on the HHS committee and with the department as well.
Great, thanks. Anybody else want to comment on that? Okay, fantastic. Okay, so here's a question. Will nonprofits who receive grants from the county be able to use funds from FY20 to bridge costs into FY20 we're not being used now, but we would hope to catch up at some point? It sounds like a Vickie question.
Yeah, we actually did. I think we might have given this answer before, but that I did check in centrally with the folks in the Office of Management and Budget who handle those grants, and we will be allowing organizations to carry forward funds, FY20 funds, into FY21. And effectively what that, there's nothing in particular that the organization needs to do other than to let us know that they would like to do that. There's not like a separate contract action that needs to happen. It's more that we simply need to make sure that that contract doesn't get liquidated at year end, which is the normal practice.
Great, so we'll have to get out some information about the best ways to do that, within the next month or 2 when we see how things shake out. Thanks.
Correct.
Heather, there have been a number of questions specifically related to food, including if you know of which food banks actually need assistance transporting food right now, and also if you could talk about whether certain nonprofits could be repurposed as food distribution sites. Somebody mentioned BlackRock, but I think that would go for any nonprofit being a food distribution site.
Yeah, thanks, Meredith. So my I think in general, what the needs are of all the organizations is shifting daily, and will be different in 2 weeks and a month from now, from where it is at the moment. So my recommendation would be, and I added the link in the chat box, but we are getting updates every week from the providers on what their specific needs are. And so it's a Google Doc, it's a Google Sheet. It's nothing fancy, but it does link to lists. It was updated just this week with over 50 different providers right in Montgomery County and what their needs are. So if you can go to that spreadsheet or to our food assistance resource directory or food assistance map, and take a look at what providers are near you or have needs that match what you have to offer and can contact them directly. That's probably the most efficient way to do it. However, if you have something specific that you would like to offer, like a location or transportation, you also can reach out to the Food Council, and one of our team can see how that aligns with what we might have heard from specific providers as well. But the transportation that we heard was just the capital area food bank specifically, and that's the 18 and 26 foot trucks with drivers. So that's a pretty unique request, but at the same time, it is matching with some of our local businesses that have trucks available that aren't currently in use because their businesses have either slowed or closed. And so I guess that gets to both the location and the transportation question.
And just staying on the food topic for one more second, there's a couple questions about whether you've recorded your Food Council Zoom meetings and whether you can make those available, the previously held ones.
Yes. So we are putting together the minutes from Monday's call. I think that should go out today. And we'll also be sending an update to Council and the Executive and HHS, trying to give a snapshot every week of what it's looking like in terms of the scope of the feeding response and the needs of the sector. So we are recording those. And as soon as we figure out how to make that link available, we will be sure to send it out to everybody.
Great, thanks. And I also want to give a shout out to the Montgomery County Volunteer Center. If people are not aware, they are collecting information from people who've come forward, faith community people and all kinds of people in the county who want to get involved and volunteer at this time. And so if you have need for volunteers, do check in with the Volunteer Center. There's a comment here, it's not really necessarily the most appropriate for this team, but there's someone saying that this online system of learning that MCPS is working on is leaving behind ESL and students with learning disabilities. Who can we reach out to at the school to provide, talk about that and provide support?
I can try to tackle that. If they want to send, and I need to give a shout out to Beth Schumann from my office, who's on this call as well and has been doing an absolutely outstanding job working around the clock. And I so appreciate her and my entire team right now. And I also want to give a shout out to Linda McMillan, who is the council lead staff member that helps staff the HHS committee and who's also been working around the clock. If that person wants to send me that email, directly to our office, we can follow up with Craig Rice's office and direct it directly to MCPS.
Great.
Councilmember Albornoz, some people are curious whether they would be able to apply the emergency grant funds to purchases made before the legislation. So in that case, if somebody had to buy a computer for a staff member that started teleworking, would it be applicable in that situation? Similarly, another person asked about whether it could be used to cover lost income due to fundraisers that were canceled.
So we've left pretty open what qualifies for the 75,000, and I think both of those are very reasonable hardships that could be articulated in the application, and that would certainly be considered because a lot of people are in the same boat.
Okay, here's another question. Is it safe for our case managers to continue making home visits with clients in permanent supportive housing programs? The city of Baltimore has stopped this practice in the wake of COVID-19.
So I'll take that one. So I know that came in from a particular provider. We've been in very close contact with all of the providers who work in homeless services. And so I know that there have been discussions in that particular group about protocols. This is also why we've shared the guidance that we've given our own staff regarding home visiting. So our own staff are going out on home visits in several places. So, you know, that's why we're sharing that information, so that organizations have some idea of how we're approaching that question ourselves. And I know that in that particular situation regarding permanent supportive housing, there have already been a number of conversations. And so I will allow those conversations to stand as they are in that group.
Anne, could you mention, I think you touched on this, but there were some questions about mental health resources for students, telemedicine, mental health resources. Could you speak to that?
Yes, thank you, Meredith. I saw that question. There is telehealth, mental health services happening currently. Most of that is through existing work, for instance, with the providers that are providing linkages to learning services already across the school system. We're one of many of those providers, so we are providing telehealth there. As far as expansion of those services, obviously that's going to be a need. I think that over the last week and a few days, it's been transitioning existing caseloads and clients to the telehealth. I don't believe there's been an expansion of that, but that's certainly something that's going to need to happen.
Okay. Here's a question. Could nonprofits use the county grants in different ways than the original purpose to shift focus to respond to current needs?
I think that's certainly our intent, is to be as flexible as possible in being able to provide support. And I should also mention, I should have mentioned this in my opening comments, the council did pass a resolution yesterday, essentially acknowledging, which the executive branch acknowledged as well, in a very helpful and I appreciate letter that came over on Monday, that the budget that was prepared and that was released on March 15th in many ways is no longer applicable. We're going to have to reassess the revenue projections for both the county and the state. And the challenging aspect for the county is we often lag behind what we see at the national and state level. And so the true impact of all of this, as scary as this sounds, is not going to be entirely felt until the next operating budget, as we figure out the full scope. And having been a veteran of our last recession in 2009, I know that that's just the very real and practical issues before us. So we want to be acknowledge that adjustments are going to have to be made to contracts and to organizations, and we're going to have to make very difficult decisions with regards to prioritizing and triaging some situations that we have before us right now, and we stand ready to work with the executive branch on carrying that out.
Thanks.
I have a two-part question. One is, what about nonprofits that were not in the HHH budget because at the time they were funded, there were extra funds in other departments? That was answered somewhat. And actually, I'll stop there because the other one's a little more complicated.
I'll take a stab at that. And BB and Caroline, if you want to jump in, I'll welcome that as well. Part of the reason that you see someone like me here is simply that HHS has such a broad and deep reach into the nonprofit community. But we're clearly not the only department that a whole variety of nonprofits out there work with. This is partly why we try to have strong partnerships with the county executive, with nonprofit Montgomery, and other stakeholders across the sector. And our counterparts in departments like DHCA and recreation and other departments that have wider connections with the nonprofit community. We are trying to have a unified voice across the county, whether that's the county council, the county executive, HHS versus another department. I obviously can't speak for those departments, but I can speak to the commitment that all of us have made to try to work together during what is a very, very fluid time. So if you have questions in particular, please reach out to the departments that you work with normally. And we will, we again are trying to speak with one voice.
I'll chime into that. Yes, Vickie, thank you for that answer. I just also want to add that we do recognize that there may be nonprofits that's not receiving our communication because they're not connected to one of our networks. For those individuals, we ask them to please reach out to us so we can make sure that they are added to our various contact lists, because we do want it to be a coordinated effort in how we are communicating. So just wanted to add that on. Thanks.
Okay, this next question has to do with the new county grant program that's opening, the emergency grants. It says, as you would know, there is an organizational revenue maximum of $5 million in addition to employee max for the Maryland Small Business COVID-19 Emergency Relief Fund. We had talked earlier about increasing the number of employees for the grant funds here in Montgomery County. Is there a revenue maximum that's being discussed for those grants?
No, right now we're limiting it to the number of employees. But I will also say that in some ways, this is likely a deposit. We are going to, this is the first wave of funds that we're making available on an emergency basis to help those organizations. Then there are so many of them that get through the next 2 months, 3 months, acknowledging that there may likely need to be more, and there will be more resources that will be needed in the future. So right now we're casting a net to try and take care of those smaller businesses that are really taking it on the chin, even more so. And that, of course, includes our nonprofit sector. I saw a comment earlier about nonprofits and businesses, small businesses being one and the same, and that's absolutely true. But also acknowledging that our nonprofit organizations are disproportionately providing a service that's critical to our social safety net. So we're trying to balance all of that out, and we're going to have to make some really difficult decisions on the allocation of funds this first time around, but our hope is to make more available later as well.
Can I add to that? I think that initially we have to try to meet the most urgent needs, absolutely, as Gabe said. But also we will be monitoring what the feds and the state are doing, and there may be some of those larger entities, larger organizations that have a better ability to access some of those funds at a state and federal level, and that the funds would be probably larger. Or the available dollars would be larger. So again, this is very fluid. I think we have to keep an eye on that and keep an eye on any support that organizations might need to apply for those dollars or to access those dollars, so that we can ensure that dollars are spread as far and as wide as we can. We want to make sure that we're also not leaving anything on the table on the federal and state level. And so if we think that somebody could be utilizing those other resources, we'll try to point to that direction. It's still real early to say, but I do think we have to keep in mind that this isn't the only pot of money.
Okay, that's good news. Here's a question about people who maybe not accessing the internet. How are they finding out about services that are available? And also other Spanish and other languages.
So that is a really good question, and something that just again reverting back to my colleague and friend Nancy Navarro, and it doesn't have an easy answer. One of the things that we're doing, in addition to making sure that we're reaching out through our social media and through our various, the internet and our websites, is we are going to be working more closely with our multimedia partners and some of the multi-ethnic television stations and radio stations. But the other thing that we had a call to discuss a little bit earlier this week is with faith-based organizations not being able to convene, it's just exasperating the problem exponentially. And so I think that, however, is an opportunity for us to work with our faith-based providers to be more intentional about community outreach. Another important asset here is our grocery stores. People are still going to the supermercados and the grocery stores, and I think we can be more intentional about providing and disseminating information through those channels, and our pharmacies as well, who have been fantastic partners, I should add, throughout this entire situation. So we're looking at expanding and aggressively moving forward with some of those direct outreach opportunities, and it's all hands on deck. Nancy and I had a call just a little while ago about better pooling the resources within the council office to complement the work that's happening in the executive branch on public information. But frankly, we need to better leverage all of you on this call and in the community as well. And that's why calls like this are also very helpful, so that you can help us disseminate information out to the community. So all of those things collectively, I think are going to have an impact. And the last thing I'll say, this whole issue is raising gaps in the system that should have been addressed a long time ago. And so one of the silver linings is that this is going to be an opportunity for us as this subsides, as we move on from triaging the current situation to build a better system than the one we have now. And I think we all have to own and acknowledge that. And we stand ready to work with Nonprofit Montgomery, all our providers, and the executive branch to be stronger after all of this is over.
Fabulous. That would be a wonderful silver lining. I've been thinking a lot about that, actually. When we're kind of getting towards the end of our questions here, somebody's asking about financial support for COVID-19 tests. I believe the county executive addressed that this morning. Caroline or BB, can you comment on that? So is there availability of free testing for COVID-19 should someone need a test?
I'm going to chime in and say that I'm going to defer that to HHS. That did not come up, not doing our 11 o'clock with the business. So if the county executive did address it, it may have been before that and I missed it. So I don't have the answer.
I'd have to, I want to make sure that we provide the most accurate answer. So I think we should, we'll come back to that one, and as we answer questions for you in writing and have you put them out.
Great.
I'd like to add two things. One is that in response to a question, yes, we apologize that we did not caption this, and we will try to make all future Zoom videos captioned for those who would prefer or need to see it in writing. So that's number one. And number two, in terms of helping and making sure people are connected, there's a wonderful comment from the Rotary clubs asking what they can do to help. So if you have things that you know the Rotary clubs could be doing to help you as a nonprofit, please let us know. We can post it on our resource page. Thanks, Lesley.
Great. And also, of course, the Rotary Club can call the Volunteer Center, since they seem to be the central gathering point for volunteers, and they're doing a great job with that. I think we're going to close out now, and I just want to ask if anyone on our panel had any closing remarks they'd want to make.
Yeah, hi Lesley. I'd like to make two additional comments. One, we did pose the question to both Dr. Gales and Earl yesterday about tests. So obviously, tests are in short supply right now. Clearly, they need to go to the people who are symptomatic or are especially vulnerable in those categories. But as more tests become available, I stress the importance to acknowledge that the term first responder is a much wider term right now. And there are a number of people who are on this call and continue to do their jobs so diligently, but are concerned about their own health and their family's health and their clients' health. And we're all flying blind right now. And so as tests become available, I made the plug that, and it could take a while, folks, we have to manage expectations, but as they become available, that they be available to those first responders, including our nonprofit sector, who have to continue to do their work and do it so well. So that's one thing I wanted to mention. And the second thing that's was alluded to earlier, but I think will need to be even more of a focus moving forward, is our special needs community, which I know is in particular feeling isolated right now and not feeling part of the discussion as it relates to, for example, the testing stations that they're talking about putting together right now. By the way, 6 of those that the governor has announced, none of them are in Montgomery County, which is an issue. And that's something that we're concerned about and focusing on as well. And then finally, I just want to put in one more plug about the importance of all of us to be diligent to reach out to our multilingual communities, especially our immigrant communities right now. All of us on this call have a role to play. Government needs to do a better job of taking the lead, and we're working on that. But we stress and want to encourage everybody, to the degree to which they can, reach out to folks. So thank you all. And our office is open 24/7 right now. So as people have questions or thoughts or concern, please share those with us at any point.
Great. Thank you so much. And thank you to everybody for being on the call. And for those of you who joined us virtually, I know I glanced over, we had over 200 people. There were probably more at the peak. So Nonprofit Montgomery, we're committed to continuing to help each other communicate and share needs, let you know what's going on in the sector, let you hear directly from DHHS what you need to know. And we'll point to our resource page on our website. If you go to the homepage, click on the COVID-19, and we will post all of the resources that were posted in the chat here today on our resource page, and we will make the recording of this conversation available. And we are committed to joining you 11 a.m. next Wednesday to continuing the conversation. Let us know what you need to hear. You can email to connect@nonprofitmoco.org or email me personally, and something you'd like to see covered in another call, send your questions. We'll keep trying to get the information for you. And thank you everybody for the hard work that you're doing.
Thanks, Lesley.
Thanks.